Oseltamivir, also known as Tamiflu, is a medication used to treat symptoms caused by the flu virus, such as stuffy nose, cough, sore throat, fever/chills, aches, and tiredness. It helps make these symptoms less severe and can shorten the recovery time by 1 to 2 days. This medication can also be used to prevent the flu if you have been exposed to someone who already has the flu, like a sick household member, or if there is a flu outbreak in the community. It works by stopping the flu virus from growing. It's important to note that Tamiflu is not a substitute for the flu vaccine. It's best to talk to your doctor for more details on how to use this medication and when to take it. Before taking Tamiflu, make sure to read the patient information leaflet from your pharmacist. You can take this medication with or without food, but if it upsets your stomach, try taking it with food or milk. It works best if you start taking it within 2 days of flu symptoms appearing or after being exposed to the flu. If you have the flu, your doctor will usually prescribe Tamiflu to be taken twice a day for 5 days. If you're taking it to prevent the flu, you'll typically take it once a day for at least 10 days. The dosage will depend on your medical condition, kidney function, and response to treatment, and for children, it will also be based on their weight. If you can't swallow the capsules, talk to your doctor or pharmacist about a liquid suspension form. If that's not available, you may be able to open up the capsule and mix the contents with a small amount of sweetened liquid. Remember to take this medication at the same times every day for the best effect. Even if your symptoms improve, continue taking it for the full time prescribed to ensure the infection doesn't return. If your condition lasts or gets worse, or if new symptoms appear, be sure to inform your doctor. If you experience nausea or vomiting while taking Tamiflu, be sure to inform your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the potential side effects. While many people using Tamiflu do not experience serious side effects, it's important to be aware that the flu itself or Oseltamivir may rarely cause serious mental or mood changes, especially in children. If you notice any signs of unusual behavior such as confusion, agitation, or self-injury, be sure to contact your doctor immediately. Although it is rare, a very serious allergic reaction to Tamiflu may occur. If you experience symptoms such as rash, itching or swelling, especially of the face, tongue, or throat, severe dizziness, or trouble breathing, seek medical help right away. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. As for the optimal timing and dosage for taking Tamiflu, it's best to follow the instructions provided by your doctor. They will determine the appropriate daily dosage for you based on your specific condition. If you have any concerns or questions about the medication, always consult with your healthcare provider for personalized advice. Before you start taking Tamiflu, make sure to tell your doctor if you have any allergies or if you are allergic to Oseltamivir. It's important to let your doctor know about your medical history, especially if you have kidney disease. If you are pregnant, talk to your doctor about the risks and benefits of taking Tamiflu. This medication can pass into breast milk, but it's unlikely to harm a nursing infant. It's best to consult your doctor before breastfeeding while using Tamiflu. Remember to always talk to your doctor or pharmacist for more details and guidance. It's important to be aware of potential drug interactions with Tamiflu, as they can affect how your medications work and may increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. If you have received a flu vaccine in the nose within 2 weeks before starting treatment with Tamiflu, be sure to inform your doctor. This medication may lower your protection from the flu vaccine given in the nose, so it's best to wait at least 2 days after ending the treatment with Tamiflu before receiving the flu vaccine in the nose. If someone has taken too much Tamiflu and is experiencing severe symptoms such as loss of consciousness or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. It's important to note that Tamiflu should not be shared with others. It's also important to understand that Tamiflu is not a replacement for the flu vaccine. It's always best to consult with your doctor about the risks and benefits of getting the flu vaccine each year to help lower your chances of getting the flu. If you forget to take a dose of Tamiflu, take it as soon as you remember. If it's less than 2 hours until your next dose, then you should skip the missed dose and take your next dose at the usual time. It's important not to take a double dose to make up for the missed one. When storing Tamiflu, make sure to keep it at room temperature and away from light and moisture. Avoid storing it in the bathroom and always keep it out of reach of children and pets. It's important not to flush Tamiflu down the toilet or pour it into a drain unless specifically instructed to do so. When the medication is expired or no longer needed, be sure to properly discard it. You can consult with your pharmacist or local waste disposal company for guidance on the best way to dispose of it. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.